Hey, my coding family, how's everybody doing? Let's see, I hope everybody can hear me. Hey, Jeninator, good to see you. Hey, Marcella, Cynthia, Beth, good to see you. Hopefully today's session should last a couple of hours. I gotta go get James when he gets done with wrestling practice. Travis will bust in here in about an hour and a half with his friend. Some of the cheer team will be here about 3:30. It's 2 o'clock here. So we'll get a tiny interruption by them, and then I'll have to go get James sometime around 4:30. So probably try to end around 4. So hopefully we can do 2 hours. Hey, Cheryl. Hey, Go-Kart, good to see you. Hey, JP. Hey, Heidi. Hey, Happy. Hey, Myra, good to see you guys. Hey, TikTok fam, how's everybody doing? Good to see you guys. Let me pull up today's document. I haven't done all the questions that I prepped for today. Some of the true and false and the first set of multiple choice are going to be like new ones that I haven't done. I don't know if they're correct or not, so we'll do them together. That's always fun to do, right? We'll just play around and see some new questions. But I did put together some new questions for today because somebody posted inside one of my chat rooms that they had a code on their exam that they could not find in their book. And turns out it was one of the new 2025 E&M codes for audio telemedicine. So it looks like as of April, because I think she took it on April 2nd, her exam, they have updated a question or two from the new 2025 book. So I wanted to make sure that you guys knew what these, I think it's like 12 new codes are, and that you've got them down. So here is our first question for today. And we're looking for an 11-letter word that means the required communication type for these type of codes. So let me, where is my camera? Where's my mouse? Where's my mouse? There's my video camera. I may have it. Oh, I gotta close this. Yeah, I know. Close that. There we go. And then properties, YouTube, and then change it back to that. Okay, here we go. There we go. And then put that there and put that there. So I was trying to take pictures of cardiovascular notes today to update some photographs for that section of my notes, but let me write down what code I was at. I was at code 33276, so I can go back and restart that, but let me open up that set of new codes that we have, and they've done like, I don't know, I really don't like the way they have them formatted and written out in the book, but because it takes so many pages. It's 3 pages when they could consolidate it into one little thing. Where's my 2024 book? Let me show you in that. I think that will be easier, because I took a 2024 book and then I updated it with the new E&M codes and turned it into a 2025 book for that set of codes. And I like the way I wrote it out better than I do the way they have it written. If I can figure out which book I wrote it in. Let's see. This might have been this one. Let me find it. I got too many books around here. Yep. There it is. So what I did was I just went to this page in our E&M book, which is page 14 if you're in the 2024 book. And then I just wrote them out right here on that blue area right underneath the special report area. That way we've got them all listed into one location. So they start out with just audio and video E&M services, then they're new patient versus established patient. And then they have another section which is just audio only, new patients and established. And then they have the one code that I think is on the exam is the one little bitty code that's by itself, which is just a technology service code number. It's the 98016. It's also the one E&M new code that they have in their magazine from January of 2025, where they actually wrote that exam question, I think, in that magazine article. And I told you guys when I saw it that if they ever do put one of these codes on the exam, it would be that code. And I think that is correct because somebody posted that they couldn't find this in their book. So it's the 98016. It's just a 5 to 10 minute brief discussion. Now in the E&M book, they have 3 pages of nightmare of descriptions and all that stuff, but it's I like the way I wrote it, and I think it's a lot easier for you guys. But so if we were talking about these telemedicine codes, can you guys figure out, if anybody has the 2025 book, what kind of, let me get rid of this pictures quick, what would be a 11-letter word about telemedicine? Anybody think about what it might be? What is one of the words that they might mention here? And you probably have to have, unfortunately, the 2025 book to figure it out. Let's see, this one's the 2025. Just because it's part of some of the fancy verbiage talking about these codes. Let me find where that starts. So in our 2025 book, they have telemedicine, and then it's that first sentence right there under telemedicine. Sorry about the crane being in the way here. There we go. So right here in the very first sentence it says telemedicine services are what? Real-time interactive encounters between a physician and other qualified healthcare professionals. What word do they use right there? Good job, Summer Rain. Perfect. Actually, really good. Good job. Good job, Geninator. That is correct. Yes, 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 guys. Perfect. Let me find my drawing tool. And that is, it's a fancy highfalutin word that we don't use in common language very often, right? Synchronous means you got to have all the stars align. I guess it's the way I think of this word. is everything has to work together. You got to have audio. You got to have your camera working, right? That's the way I think of synchronous meaning, right? And you know, if you've worked from home as long as I have, it is always a challenge, right, to get everything synced up and working correctly. So I thought that was a cool vocabulary term, is the only reason, yeah, using it today. All right. What is a 6-letter word? What is not a must to get from a patient before a telemedicine service? Let me switch this camera around. Oh, sorry, what page, please? That was page 17 if you're in the 2025 book. If you're in the 2024 book, it's not in there. Sorry, Crafty, if I don't see your guys' messages. Thanks, Go-Kart. And who else was that? Oops. Summer Rain. I failed my CPC exam last go around. I take it again in 2 weeks. Fingers crossed. I'll have my toes crossed for you too. Aw. Got here just in time. Great, Sam. Yes, that was me. Nell said it. You're the one that said that that code was in there? I've got a way you can write those codes in there really, really easily. Sorry about you guys. If you guys are on TikTok, there is another view of this on YouTube, which is much better to see because you're getting a direct screen grab from my cameras straight to your screen. So I have this document in my shop that'll turn your 2024 book into a 2025. I think it's like 20 bucks, but you can write in all those codes right there. You can also go to the AAPC Knowledge Center. Let me show you real quick. So let me go to add a window capture. Yep. And we're just going to do right here. Yep. So if you go to the AAPC website and you go to, let's see, which one is it? Resources? Yep. Go to Resources tab right there, the Resources tab, and go to AAPC blog right there. It'll take you to their Knowledge Center, which is right here. And then right here is a search feature. Type in 2025 new codes, right? Type that in. I'm sure AAPC has written out some new things in the, they've written out blogs listing out all the new codes and what they mean. So you just got to find it right here. Okay. There it is. AMA releases quarterly updates right there. And they'll have a list of all the new codes and their descriptions, and you can just copy it from here too if you wanted to. So you can find anything that you need like that in the AAPC for free Knowledge Center. But I, of course, got it in my shop on my website if you want to download it and then just turn your book into a 2025 before your exam. And, of course, everybody knows that's at medicalcodingbyjen.com. Yep. So you got that. Don't forget about Pocket Prep, utilizing the link that we have right there on our site that can take you to 750 practice exam questions. Super cool. Just click on medical and then click on AAPC CPC. And they have 750 practice exam questions. Really reasonable prices, $15. If you do the 3 months for $39, then if you don't pass, they'll give you another 3 months for free. They have a pass guarantee. Also, you can even try it. I keep forgetting to say that they have 30 questions for free that you guys can just try even without nothing. And don't forget, also on my website, we've got free practice exam questions right there under the word that says free practice area. You can go there and do a bunch of free practice questions too, okay? Super helpful. All right, back to our stuff. Where am I at? Right here. And then let me get rid of that. There we go. 6 letters. What is not a must for patients getting telehealth services? What is not required? What word? Right there. Sorry if I missed your comment. You can always retype it in just a second. I'm not looking at chat right now. I'm trying to make sure I got stuff set up right. So hang out just a sec. But I know chat's going to be full by the time I get back to it, and I may have missed something, so hold on just a sec. All right. Forgot to set up my other cell phone so I can see TikTok chat better, because it's harder to see it without bringing up another cell phone. All right. Okay. Going back to YouTube chat for just a second. Oh, please pin comment. Where are we at? Okay. I'm trying, go-kart. Sorry, I'm out of practice right now. I've been trying so hard to get everything done that I've been promising. I got the CRC notes out and published last night. I have the CRC workshop replay link up in the shop also. The last thing I got to finish before I can go back to doing routine lives for free, you know, like I'm supposed to be doing 3 days a week, is my taxes. I still have not filed my taxes, so I've got to finish that this weekend. When I finish that, then I will have all the little check marks done that I've been putting off to the last minute. So, yes, I got to finish taxes. I use it all the time. You use that word, synchronous. Oh my gosh, that's a highfalutin word. I cannot imagine ever saying that word. I'm going to have to start saying it now. I'm here and I just have to listen for a bit. Aw, Cynthia. Good to see you. It's so worth buying her notes. Aw. To update your 2024 books. Thanks, Beth. If you buy a membership, do you have access to all your notes? No. Memberships are either just for access to bonus YouTube videos, which is $5 a month. Membership on my website, which is $8 a month, or $9, I think it is with tax, is just for bonus practice questions and bonus PDFs to download that are not my PDFs. They're stuff that I found through the industry that are free and available over the internet. I've gathered them and put them all in one location where you can just download them. Like if you're in the cardiology practice exam question area, you get bonus practice questions from me, but you also get all cardiology stuff, like a ton of anatomy stuff and things that you can download instantly all about cardiology, right? And then if you move on to ear, nose, and throat practice question area, you get a lot of practice questions in ear, nose, and throat, and then you get all the PDFs that I found from anatomy, code-related, AMA stuff that might be relatable, anything that you need for that area that's bonus material, I have it there for you to download. My notes are the only thing that I sell to make money, so that's my income for me and the boys and my mom, you know. So those are not a membership thing. They're just sold by 5 cents per page of my time working on them. Some sections are bigger and they cost more just because there's more pages. That's all. And I price them at like 5 cents per page. So that's it. But I teach for free and all that other stuff. So that's the only thing that I sell. So, but in my YouTube video membership, I also have every section of the notes at least started for you in that $5 YouTube membership. So even if you only have the YouTube membership, you can get something from every section for free in a YouTube video just by having that YouTube membership that will get you started of making notes in every section for free, basically, and then you can just finish it yourself. I'm not, I do a lot, and I purchase a lot, and I research a lot, and I'm real proud of my notes, and I do spend a lot of time finding out what doesn't work for students, getting feedback, and looking through every comment on the internet about what they didn't have, what they wish they had, what didn't work for notes. And then I also purchase everything from AMA that gives me the full description of the notes. Like, you have to buy for every year. They'll publish just a few of the codes in these manuals, but not every one of them. So you have to go by every single year to get the full description of the CPT code descriptor. So if you wanted to know what code 62305 really is and what it does inside of it, you have to buy this book. And then they don't publish it every year. They'll only do a few codes every year. So I go through and I've bought every single year of these so that I can go through and then I condense what exactly is going on inside each code and then create my notes that way. So it's a lot of work, but I create them from the exam point of view, not from a medical coder point of view, so that they are focused in on helping you guys pass the certification exam. Anyway, Blanca's asking about vitals. Not vitals. Sometimes you can get vital signs on telemedicine visits. Did you know that? When I was working in our offices in Cali, we would send our patients electronic blood pressure cuffs that would hook up to their cell phones and also would hook up to their desktop computers. And they would sit there, even their scales from home, we would send them a scale, especially our CHF patients. We would have them get on a scale that was automatically transmit their weight, water content, fat content, all kinds of stuff, their bone weight, all that to an electronic chart as we're talking to them. You'd be surprised how many vitals I could capture from a patient from their home. So we can get vitals. I'm going through the program, but love your notes. Wondering when 2025 notes are done. I'm gotten to the point where I've redone the notes every year, 5 years in a row, and I'm pretty happy with the way they are. And they are not going to be updated every year. It takes me 6 months to redo them every year, and that time is taken away from being able to teach you guys live for free or being able to tutor individually. If I'm making the notes, redoing it over and over again, like this is 2024, this is 2023, this is 2022, 2021. If I'm sitting there for 6 months redoing all the notes and I'm not making enough markable changes in them because the exam hasn't changed, then I'm just spinning my wheels for no reason because they don't update the codes. There's no new codes in anesthesia. For the 5 years I've been making anesthesia notes, they've been the same set of notes and same set of codes. Unless I find something super valuable that I need to update, I'm not going to redo the whole year. So when you're looking for 2025 notes, I've already done the E&M section. Those have been up, and that had 12 new codes in it. So that needed to be updated. But as far as anything else that's up there, what I have for that section is what you need to download and put in your books, no matter what yearbook you have. So don't sit around waiting for 2025. I'm done. I am going to be taking more pictures and updating some pictures and making more of like, okay, this is cardiology notes and that's it. And then this is, you know, anesthesia instead of calling them per year. So, you know, just that's what's going on there. All right, example, I think could be wrong that you put a video of you working on each section. I did. Consent, Geninator, you got it. That is correct. Consent, because they are logging in on the computer remotely from their home, and it takes so much action on their part to get into the system and log on to your system that consent is not required. Isn't that cool? Yep. Perfect. All right. Next one, 8-letter word that means the complexity level used in code selection for risk. The complexity of what? What is being complexed? What is it? And let me keep back on chat and see what I missed. Consent is 7 letters. I have it wrong, don't I? Woo, dyslexic. You're right. Sorry about that. It'd have helped if you'd had correct number of letters, right? You guys know I'm only human here. So the most comprehensive notes we would buy for notes. What is the best way to purchase them from you? Hopefully you don't have to purchase anything from me. My idea is for you to go to my website, go to the resources tab, go to the tab that says CPT Book Prep. I have 8 pictures there that tell you what to do. Click on each picture and it tells you what to do. It also has a list of anatomy pictures, and then it has a list of ICD-10 pictures there. There's also underneath that tab called CPT Book Prep Videos, where I have the digestive system for free on my website, showing you how to do the notes in that section, because that one has a good anatomy picture right before the section, so it goes through the anatomy and then the CPT codes. So my idea is for you to make your own notes as you're going through your courses or watching my live lessons, and go to that page and do them for free. Take your exam. If you fail that first attempt, you get a second attempt for free if you're going through AAPC. You'll get a breakdown on which sections you did poorly on, and if out of integumentary all the way through medicine, E&M, and ICD-10, if any of those sections you did really poorly in, then you'll know which sections to buy of my notes, so you don't have to buy them all. But yes, there is a bundle on my website for everything I've got if you want to purchase that, or you can go through and buy only the sections that you need if you fail the exam. We're not complexing moderate. So what is being complexed on this? When we're doing risk adjustment, it's not data like, under data, it's like lab results and, you know, things like that. When we're doing the problem list, it's their chief complaint, right? So under risk, what's being done by the doctor under risk? What is it? The doctor is making a Of course, Jenny, it is, you are able to self-study. I self-studied my way into passing the CPC the first time because I did not want to learn how to medically code at all. Didn't need it for my job. I just wanted the certification. I also self-studied for the CPMA, and I self-studied for the CPCI instructor course. You can absolutely self-study. It is no requirement at all that you do take a course. I do have a course for those people that are bound and determined, or just going to insist on buying and purchasing a course. I do have one starting in April 8th. But my ideal with this course is that you get access to a APC self-study course for a year, right? And you go through all their videos, all their workbooks, and you have access to their course for a whole year. During that year, you have 12 weeks with me to prepare you for your certification exam and to go over anything in that course that you don't understand how to do. And you could schedule that 12 weeks with me at any point. But I do have a course starting April 8th if anybody wants to join in on the course. And it is at cost for me. So what I am charging, and you get 4 attempts with this course, is what it cost me as a teacher. I'm just going to send the money straight back to AAPC because 10% goes to collecting fees. You know, the MasterCard and Visa people want their money. My website, and AAPC charges tax and shipping on top of everything for me to purchase for you guys. So the course price is at cost. I'm not charging you guys anything for my services. So it's on my website if you guys want it, but you absolutely do not need a course to pass. This one's pretty tough. Michelle, you did get it right. Royal, you too. Good job. Kelowna, good try right there. Yep, decision is what we're doing for this one. That one was tough. That one, the next one will be super easy. I had ChatGPT help make me these. And it said synchronous was 7 letters long. I had fixed that one before you guys saw it. I'm like, it cannot count how many letters are in a word. It really had a bad, challenging time with this. But I did have them help me make these. Type of telehealth service that uses sound only. Who is that? I missed 99 messages on TikTok, so I'm sorry, guys. Who's doing that? Who's sending all the gifts? Ella, she always does that. Elena, I'm probably saying that wrong. Audio is correct, V. Hey, Kitty Kitty, good to see you guys. Hey, Sarah. I was in a program where I could take the CMAA and CBCS certificate. Oh no. Along with the CPC? Wow. I'm done with the CMAA as part, and I'm ready to bunker down for the CPC. That is cool that they're doing all of them. I don't know anything about CMAA. I know the CBCS is not recognized by employers, but it's okay that you'll have it as long as you do get that CPC. Out of those 3, your core, as far as what employers are going to look for, is that CPC. And from the exam point of view is how I teach. So, yep. Audio is correct for this. I am in Arizona. UDIO. One more, and then we'll move on to true and false. Where are you going? 3 and a 7-letter word for visits that occur for the first time. Yeah, that's why I didn't choose the CMAA. I'm just going to do, okay. I know what you mean, the CBCS, yeah. They won't even let you sit for their certification unless you take their course. But then they don't tell you that their course is not recognized. I want to take the CRC, get that certification, and then I want to do CCS, and then become an instructor for CCSI. And then I think I'll be done with certifications after that point, because I'll have enough CEUs to keep up with at that point. I think there's some ambulance certifications that some people go for with a different company. Like if you're going to do billing for like air, ambulance, or something like that, there's another company that does some sort of certification that some employers require. I might look into that one of these days, but I've only had 1 or 2 people ask about that certification. I purchase ahima's stuff and I go to their webinars, but I have not taken their certification yet. And but I do own all their workbooks, and I attend a lot of their workshops, webinars, and that kind of stuff. They're very cool. And I like the fact that they are not for profit. They are non-profit. Y'all got the new, the second word ends in a T. There you go, V. Patient. Yep. All right. Now, ChatGPT helped me make these true and false questions, and I have not checked them to see if they're correct. Let's see. And then after we get through with these true and false questions, I've got 5 multiple choice questions, and then we're done with what we had created for today's lesson. And then we'll go back to AAPC's actual questions that they made themselves. I'm just trying to make this bigger for you guys. There we go. All right, true or false? 98012. Is it used for audio video visits for established patients? So 98012. This one right here. And in our book, it's right there. Like I said, TikTok, if you guys are on TikTok and want a better view, you can go over to YouTube at Medical Coding by Jen on YouTube. There is probably a better view for you guys over there. I got lots of truths and lots of falses. So, what's our blue header? Our blue header is established. Now, what's your red header for this area? Synchronous for audio only. This is saying audio video, right? You always have to check your red and blue headers. No matter what section of this CPT book you're in, don't ever go to the code only and read the descriptor. That ain't gonna help you none. Remember, red and blue headers need to be checked first, right? And you had it right the first time. Aw. Check your red and blue headers. One thing that will help you guys pass more than anything else on this exam, if you've taken it before, then you've gone straight to the actual CPT code and read the descriptor and tried to pick out the answer from that point of view, and that's why you failed. Now, instead of doing that, for every available answer, if you will look for that particular code's red and blue header first, sometimes black header, before, and check your question to make sure you're under the correct red and blue header before you look at the CPT code descriptor, that's how you'll pass this certification exam. You've got to practice your practice exam questions by doing it this way because you need speed. You're adding some more steps to each question's process, right? Because you have to go back. Sometimes the red and blue headers are on different pages than the codes are. They might be 5 pages backwards. You don't know. And you're adding more turning pages, more physical work, and you only have 120 seconds per question. So you need to practice these steps. My best advice is to go to my workshops in my YouTube videos where I have, like the workshop for March was 4 hours long and we did 130 questions. So there's not a lot of talking. There's just question to question and movement in the books, right? You need to get your movements as fast as I am. And those workshops are concentrated areas where I'm not talking about what services I have and all that kind of stuff. Sorry, you guys. I forgot to cover up this one. I thought I had a thingy over the top of it. Let's see. True or false, 99441 will retire in 2025. Did it? 99441. I think that's true, right? Because we saw the answer a minute ago, but where would we find that? We would find it in, do we find it in here? Is it in our 2025 book? Like I said, I haven't seen these questions yet because I just had ChatGPT make them for me. I was seeing if it could actually do it, but most of the time it just writes silliness and wrong stuff. One of these days it'll get good at this. 44. Can we find it in here? That they deleted them? But that one is true. They were deleted. Yep. All right. Our next one. All new audio codes require at least 10 minutes for medical decision. So we need to go back to our guidelines over here for our telemedicine, which is around page 17. What do you guys think? What about this one? All new audio only, not video, audio only, require at least 10 minutes. I probably just made it really easy for you guys. I need to stop helping because you guys during the exam do not have me reading out the questions, and I can't tell you how much of a hindrance that is. So when you do my workshops and you're watching those replays, just turn my audio off, and as soon as the question is up on the screen, just set a timer on your desk, give yourself 2 minutes to do that question, and then release the video and see if you got it right. You need to practice without my help too. I make it too easy. what ChatGPT said. What they say? It did say true. They do require 10 minutes. I think the last one, which is that 16, the brief one, says it could be 5 to 10 minutes. But is this one? This one's, is it a brief communication technology-based service? I wonder what that is. If that's video or audio or virtual. A brief synchronous communication technology virtual check-in. Video technology is not required. Audio services. I wonder if they're not considering this to be audio only. This one's just what they call a virtual check-in. Virtual can be 5 to 10 minutes, but I'm assuming audio all needs to be more than 10 minutes. Just hyper fixated on auditing the question is all. I don't know if I like that one or not, because technically, I don't know, the virtual thing is tripping me up. But anyway, all right, audio videos on this one. Is this true or false? Synchronous audio video codes are this to that. Is that true or false? I had 6,000 taps on TikTok. Oh my goodness. Thank you guys. How many we got on YouTube? Let's see. We got 14 likes and 26 of you guys on YouTube. Thanks a bunch. All the engagement helps out, for sure. Just watching the videos helps out. We got $17 last month. It was really cool. First, a little paycheck from YouTube just for watching the videos. It's really cool. No, nobody has to buy anything or anything, so that's really kind of cool. It's awesome. And I just turn that money around and send it back to you guys and give away some YouTube memberships. So I'll be giving away 5 YouTube memberships in just a minute. So if anybody over on TikTok wants to join in the chat on YouTube, y'all join in over there, and then YouTube will pick out the winners. I don't have any control over who wins, but I'll send YouTube some money in just a second. And we'll have it pick out some winners, and you'll get access to all my exclusive video content, like the workshops and stuff. The podcast where I'm reading out the guidelines and the old duck classes, all for free. Let's see. ChatGPT says this one is false because this one is audio only, and then these codes are audio and video. I think everybody got that one. All right, what about this one? Documentation should include platform, consent, and time. Is that true or false? There's V. Good to see you. All right, let's give out some YouTube videos. Let me send money over to YouTube. Here we go. Let's see. Marcella, Miss Ann, Samantha, Dee Dee, and Consuelo. Congratulations, guys. We gave away those YouTube memberships. It'll be popping through here on chat in just a second. All right. I'm going to try my best to go live again tomorrow. I don't think we got too much planned except for my taxes. I got to get that done. And then again, live on Monday. So if you guys are looking for me to go live, I don't have the link up yet, but I'll post that as soon as we end this live. We'll do 2 more hours tomorrow. I can't think of anything that I'm forgetting that I should be doing tomorrow other than taxes. We'll see. Well, the boys will be home from school. No, I gotta take, wait a minute, I gotta pick up, okay. I forgot, I gotta pick somebody up from MathCon tomorrow, and then, I don't know what time that is. And then James has wrestling practice tomorrow. So I have to figure out when those kids need picked up from school tomorrow, and then I'll let you guys know. I'm sorry. Probably be more along the lines of like 5 o'clock time instead of it was 2 o'clock this time. The kids don't have school tomorrow, but apparently they got other stuff going on. James has wrestling practice tomorrow, and then a friend who is out of town, their kid is at MathCon. Oh, that sounds atrocious. But I'm going to go pick that kid up and make sure they get home all right. So, all right. This one, we already kind of talked about this one, that we don't need consent. So I'm concerned that this one might be false. They say it's true, but that is not true. I think this is an incorrect answer or question.
She donated $2 through SuperChat.
Oh, yay. Thank you so much for the donation. Support of the content is greatly appreciated. Thank you, thank you, thank you, Beth. I think this one's false. We don't need consent. How can you write the first question and say consent is not needed, and then you write it as true here that you need consent? But it depends on what you're talking about. What are we talking about? Documentation should include platform, consent, and time. Platform, yes, they need to know what are you on, Epic or whatever, but I think this one's false. We don't need consent. Anyway, it's just playing around with ChatGPT. I don't think they got that one correct. All right, what do you guys think about this one? I had ChatGPT also write this one. Which code is used for a new patient synchronous audio only visit with high MDM? Okay, that's a cool, good one for you guys to do. Baby practice. They should be able to get that one correct. ChatGPT is so incorrect all the time. I built my own ChatGPT. If you go into ChatGPT and you look for other like whatevers, there's a medical coding by Gen 1, and I've been trying to train one, but I ain't got time for it. It's way too wrong all the time. I'm hoping one of these days it'll get better, but it's fun to play around with just to see. But out of 5 questions, I am lucky to get 2 that are correct, 100% that I would go for out of 5. So, and that's just giving them a small bit of information. What I gave them today was just only information, only on these 12 codes that was written up by AAPC. It said, you know, this is what you do, this is what you don't do, and it's only about these 12 codes. and I asked it to write me 5 true and false. And, you know, out of that, it still couldn't do it correctly. So it's still got some work to do for sure. And then it definitely cannot count how many letters are in a word. I corrected a bunch of them before you guys saw it. What do you guys think is the answer to this one? Everybody saying A? Let's see what ChatGPT said it was. It said A2. All right, good. All right, what is the minimum requirement for reporting code 98000? Is it 5, 10, 15, or 40 minutes? That's an appropriate question, I think. That looks good. What do you guys think on TikTok? I still got 26 over there. Thank you guys so much for the gifts and the shares and tappy taps. Everybody saying C. Let's see what ChatGPT said. C. 15 minutes. Good. Is that correct? All right. Which of the following is being retired in 2025? We already went over that one. Wasn't it the 441? It's definitely not that one. So I think it was the 441, right? Yep. All right. And which documentation element is not specifically listed as required for telehealth visits in the guide? Yep. Well, the guide is what I sent the ChatGPT. You guys wouldn't know what the guide is, what they're talking about, so I need to change the question to at least just that. And you see, it wrote this question and says that one of them isn't required, but then it wrote a question earlier that said it was required. So silly. Can't keep its facts straight. It says B, diagnosis is important, but not listed as a required for documentation of an element. Yeah, well, we're going to change that to A, consent. That's funny. Yeah, let's just send a claim without a diagnosis code. How about that? Let's see how long we keep our job. Okay, ChatGPT. Okay, what is the code 98016 used to report? Six. What do you guys think? Brief is good. That's a good question. Perfect. Good question. All right. Let's get back to AAPC's designated real and true questions so I don't have to worry over what's written here. Remember, if you're reading any of this question's answer right now, you're doing it wrong. What we're going to do is look at the available answers, right? We're going to think about them. We've got 2 answers that are in a 5-4 area and 2 answers that are in a 5-6. When your second and third digits are in different numerical areas, sorry, ChatGPT. TikTok needs me to do the damn puzzle. I didn't do the puzzle right. Try again. Oh, I missed it. It's hard to do when you have this thing up in a crane. 3rd time's the charm. Okay, So when the second and third digits are numerically different, usually you're in a different section of you have a different header. You know, your red and blue headers are going to be in different areas in general. Not always, but in general. Let's go see. What is our 254 red and blue headers? And then what is our red and blue headers for 256? 25400. Headers. Repair revision of what body part? So this code and this code are under what blue and red headers? That's the first thing I'm asking. Thanks so much, Beth. I finally tried the practice test and used the 2020 books. I haven't had any notes in, and I'm getting in the mid 60 averages. That's really good without any notes. That's awesome. This is a prime example of why AI won't take over medical coding. That's true. That is true. There is no way. Repair wrist. Forearm and wrist. Yep. We got to go back 3 or 4 pages. Yep. And then we're also under repair revision. For the 256s, what is the difference? The 256s, the blue header is under a fracture. Are we dealing with a patient who has a fracture? If we are, we know our answer has to be in the 5-6 area because our blue header, right? We got ourselves down to a 50-50 shot just by looking at the blue headers and not at the CPT code descriptions or descriptors themselves. And that is a vital, extremely cool thing to learn how to do for your exam. Now all you need to know is, are you a 5-6, 07, or 09? The 09 you cannot do by its code descriptor. You have to go look at its mama code, which is the 08 code. You need to know the difference between the 08 and the 07 to know whether you are doing one code or another. This code is intra and this code is extra. And that's the only difference you need to look for in your question. And this one might be 2 pages long. So are you intra or are you extra? Can you go over practice questions that are not multiple choice, the ones that need to code? I can. We don't need to know how to do them from the exam point of view, right? Do I even have, let me see real quick, do I even have access? Let me see real quick. Let me see, do I have access to those anymore? Let's see what I've got. My exams. Sorry guys. I'm going over here. So let's see, do I have access to those anymore? Probably not. I think C and D, yeah, I don't think I have access to those. D and E now have fill in the blanks, and I don't have access to those anymore. And I just spent $10,000 on AAPC. I don't want to spend any more to buy them again. So all these, none of those have fill in the blanks, I don't think. Those practice exam questions. Maybe. I wonder if any of the CPMAs have a fill in the blank. I don't think so. Do any of the CGIs, the surgeries? I wonder. Do any of these have fill in the blanks? They all do. I'll have to do that for tomorrow's live. I'll go find the questions that have the fill in the blanks and do that tomorrow, because I'm not sure I could find a question real quick that has a fill in the blank. I'm sure I've got the CICs in Blackboard. Those are a nightmare though. There's like 15 fill in the blanks. Oh my God, they're a nightmare. But yeah, I'd have to find that. Where's today's live? Okay. I just feel overwhelmed when I do them and I need to know what's the best way to do them. So if it's the diagnosis codes, you know, it's a lot of times it's one of the last words in the diagnosis. You know, they'll start off with cystic fibrosis syndrome or something, you know. It's the last word in the diagnosis that you look up in the alphabetical index. And that's how you find it without A, B, C, and D. And then for procedures, that is really kind of interesting. Is like for this procedure, when you figure out the answer, right, for it, or for this one, when you figure out what the answer is, what did they do today? They did a dissection. And so our answer for this one right here is C. So if we go to our code 23075, so let me show you in the book. So if we go to 23075, 23075, somewhere around in here. 23075, where are you at? There you are, 23075. You'll see that its blue header is under excision. And when you're reading this exam question, if you wanted to figure out, how do I figure out what am I doing here? They never say the word excision, which is your blue header. They say dissection, right? They say it a ton of times. They don't say anything about excision. And then if you go to the back of the book, how we're supposed to look up CPT codes, like if we didn't have A, B, C, or D, how in the heck would we figure out what we're going to go look up, right? Can we look up dissection? Or do we need to know the word excision, right? Then do all your practice exam questions in reverse order, like you would not have A, B, C, and D, right? So if I was going to try to learn how to do this without A, B, C, and D, I would take every question that I do know, and I know what the answer is, and I would reverse figure it out. How would I find this in the book? Would I look under dissection? Let's go look and see. D-I-S. Or would I need the word excision? D-I-S. Dissection is in here. What did we dissect? A mass of the soft tissue of the shoulder. Soft tissue? Can we find that here? All we see is vessels, sinus, adhesions, bulking, donor organ, facial, lymph nodes. Don't see shoulder. I see dislocation. So that tells me that with this question, if I was going to find the answer without knowing an answer, that I would have to know that the word dissection, if it's not going to be listed there, that we would have to also know the word excision, right? So I'm going to write E-X-C-I-S-I-O-N in my notes next to the word dissection, so that I know that if it's not there listed, I need to go look at excision probably. Let's go look at excision and see if that matches. Or would I look up the word shoulder? Let's go see. Excision. I would assume we need to look up excision because it's the header that's before the code set, but since I don't code as a coder, I would have to learn just like you guys on how to do this without ABCD. And remember, you trying to learn how to do all of this in a paper book is not done this way in real life. When you get a real job and you go work for Blue Cross Blue Shield or Tom Jones Medical Group, Tom isn't going to have you looking in the book in this paper index looking to code like this, unless you work for a granny doctor's office whose cousin's billing, right? All major medical groups are going to have Google that you're searching, basically. It's a medical coding Google. And you're just going to type the word dissection shoulder, and it'll bring up the codes for you. So you freaking out and panicking over something that we don't even use in the real office, it's not, don't worry about that. But if you want to worry about it, I'll show you how to worry about it. Which means we'll go to excision, right? And then we'll go, and that does show up with a bunch of options, and we can go to shoulder, mandible, sinus, let's see, shoulder here, S-H-A-B-C-D, skin gland, skin's there, but nothing in the 2000s at all. Sternum, spleen. Maybe we should look up shoulder. There is shoulder tumor. There we go. And there's the 23075. There it is. Ooh, yeah. So we had to look up excision, shoulder to find our 275, which matches with when you're over here in the book and you do find out what your answer is. 23075 matches up with what's written above right here. But your problem is your question won't say excision. They might choose a different word. And that's why it's handy to also write in your notes next to the words that say excision, aka dissection. Is that making any sense? I don't know. I'm just troubleshooting while I'm live and coming up with an idea while I'm here live with you. Just if I was wanting to know how to medically code in this paper book, and all I've got is multiple choice practice exam questions, how would I do it? I would work it out in reverse. Once I figure out what my answer is, and I know I'm, the 7-5 right here. Okay, how do I match what's here with what I would only have available if I was doing this live without multiple choices? And all you get is this alphabetical index, right? So I would learn how to match the alphabetical index with the headers, the red and blue headers, and the verbiage from the questions. That's going to be vital because they don't use the same words that are in your CPT book intentionally so that it confuses you, right? So excisions are AKA dissections, and then also when I went to dissection, I knew that I couldn't go to that word, that I needed to go to excision, so I wrote it next to dissection so that that would refer me to excision, so that I've got all my bases covered if I was to do this one without multiple choice. So, yes, but if you're just trying to prepare for your certification exam, please, you're going to drive yourself crazy learning how to do this paper-wise. No one uses the paper. Everybody Googles. What is the answer in real life while you're coding patients? Plus, your patient charts will all have these surgeries already coded in them. You can query your system in the EHR. How do I code a dissection of a left shoulder? Your physician has done this surgery I don't know how many times. It's a common procedure, even if it's a car wreck or whatever you're doing, ER visits. It's been coded before. You can actually query in the EHR, how did they code an MVA with a shoulder injury? And you can look up and see how it was coded before. Anyway, you will have policies and procedures in place that will tell you they only code with this modifier, or they only code with this code, and they'll tell you what to do, and it'll be totally different than what you learned in school or in this book, and it'll all be written out for you, so no worries. All right, let me scooch this down. It's a little large. Get to this question and get back to that. So we don't have to worry about our first set of codes here. It's all the same. Then we have 3 of them that all have the second answers the same. The modifier is all the same. Don't have to worry about that. We have 2 of them that are in the 4 5s and 2 answers that are in the 4 6s. We have 2 answers that are 3 1. One of them has 4 CPT codes. This one has 1, 2, 3, 4, 5. No, is that right? 5? Yep. This one has 4, 4. It's just a difference really between your 3-0 and your 3-1, really. If I was looking for similarities, I would pick A, B, and C, and then just A and C because of the 45s, and then it would be just a difference between A and C's 30 and 31 is my difference. And I would go look up those 2 codes to see what's going on there. 209, 30, and 31. If you wanted to learn how to do the process of elimination, look for similarities and irregularities, this is how I would do the question, but do it how you think, whatever process looks good to you. 30 and 31, they're both add-on codes. They're both graphs. Did we do, they're both for spine surgeries. Did we do structural or more does that? Osteopromotive. Are we helping them move or not? Very cool codes. They're giving us some hints. They also have some words to match, which is very nice and handy indeed. Thank you very much. So if we're going to keep our 30s, because we're matching this, we can get rid of C and D. Another thing that you can do to verify you're in the right area is also look up the differences between your 40 and 45. Because you know you got your 30 in there. 228. $45 and 46. How many vertebrae did we have? Sorry, let me get this bottom sentence y'all gonna need for that on the screen. There we go. So, here's how many vertebrae we got. And that's a decision 40 and 46 are held by. So what do you guys think is the correct answer? You're very welcome. I found some new practice exam questions from somebody that has them published out on some website somewhere. I added them to our membership. So if you guys are on, and you have the practice questions on my website, the bonus area, the bonus practice question area, that's that $8 membership where you got all those bonus areas. The very bottom one I added a week or two ago, and it's just these links. It's the links to their questions. So if you go here and you type and you just click on CPC Practice Exam 1, it'll take you right to their exam, and then you can just pick out what you think the answer is and then hit check, right? And it tells you whether you're correct or not. And then you can go on to the next question. It'll say next, and then it has like 20 questions right there, and then you can go to exam 2, exam 3, and exam 4. So it's pretty cool, interactive, and they're, you know, they're all right. There's one or two questions I don't like. One of their E&M questions has deleted codes in it, but other than that, they're not horrible. But, you know, it's 4 more exams questions, and at least they're not one sentence like Exam Edge or whatever. So, and they're free for everybody, so that they're just there. So it's pretty cool. So anyway, that's there in case you guys didn't know, for those. And then the risk adjustment area, if you're doing that certification, you've got your own practice question area that has like 600 exam questions and then a ton of bonus PDFs that you can download. And then if you're ever wanting to do practical coding, Practicode, we've got some help there for you guys, a membership there for those too. But don't forget, you've got the free practice area that everybody can go to and do practice questions right there. Don't forget about the blog. It is never looked at, but a wonderful spot to look for medical coding situations. Like this is a whole blog I wrote on infusion coding. If you wanted to know how to do the time and whatever on infusion, really cool area. You can read all about it, broke it down into easier little sections, even put you in some charts and stuff. How do you code what? What is it, a push? How do you code it an entire hour? So anyway, it's really cool. And it's all free for you guys. Don't forget about the resources tab, totally free. If you're looking for anything to help you guys out, go to the FAQ area. Questions are answered right there. CPT book prep and book prep videos are right there too under the resources tab. If you want tutoring or just to spend an hour with me and ask me a bunch of questions, tutoring is up now. Or I can prep a practice exam question area for you, and we can do practice questions if you want. And don't forget about the course that is there, and Pocket Prep, the Amazon list, of course, for you guys that want to know what pens do I use, what camera do I use, what highlighters, what keyboard, what mouse, what chair. Ooh, I got me a new chair today. Yesterday, day before yesterday, put it together. I'm gonna have to put it up. I always have to try them out before I put them in the store. This one's nice. And then don't forget about cell phone service, guys. If you guys are paying a lot for T-Mobile or Verizon, look into Mint Mobile. I'm seriously paying $15 a month, and I have unlimited data, hotspot, all that crap. And what you do is you just prepay. So if you prepay for a year, they let you pay 90 days in advance. So $45 for my line gives me 90 days access to Mint Mobile. And I have unlimited everything. Data, hotspots, Mexico, whatever. Who cares that I prepay for it? There's barely any tax or federal fees on top of it, so it's like $50 for 90 days to buy a year plan. And then in 90 days, they'll charge you again. But they remind you a bunch. Plus, you get cards from, handwritten notes or something from, what's his name? The actor dude. But anyway, I went from Verizon to Mint Mobile. Now, I don't make any money off of you guys clicking that link because they don't pay for advertisements. But if you guys go there and you use my link, it's pretty cool. It's nice to see that somebody clicked on it. But you guys can save a lot of money. I did Verizon for 10 years, and I get, just as good service with Mint Mobile because they're all using the same towers now. So than I did with paying $260 almost a line for 2 lines, and now I'm paying $45 for 90 days per line, but that's 2 lines, so I'm paying $100 basically because it's $85, $90 with tax, so I'm paying $100 for 2 lines for 90 days. It's less than 1 month of my Verizon bill, and I'm paying for 3 months at a time. I'm telling you guys, it's crazy. Don't waste your money thinking you got to have some month to month with whoever. Unless you grandfathered into a fancy, nice, cheap plan. Geez, I'm paying nothing for cell phone. It's nice. And I have my Samsung 24, S24, whatever. Yeah. Brought it on over. All right, guys. What'd you guys figure out is the answer for this one? I have used a track phone since the 1990s. There you go, girl. Save that money. But I'm loving this Mint Mobile thing. I think it's great. Plus, you know, you can call their customer support line and ask them any question, like, you know, what's the migration patterns of the orca whale, and they'll answer it for you, and they'll talk to you just to hang out with you. Their customer service is great. They pick up the phone. It ain't 1-800 transfer you to I don't care. You know, they some chill folks. I totally screwed up my onboarding too. I put in the wrong code for the wrong cell phone and totally messed myself all up and had to call customer service to straighten it all out, and they fixed it right away. I didn't have to be transferred to somebody that didn't know what the heck I was talking about. They're great. This question, did you guys notice how many, if you use 22854 or 22845 or 46, there was a difference in the amount of vertebrae that you did, right? So in 4-5, it's 2 to 3 vertebrae. We've got 1, 2, 3, 4, 5, 6. 6 vertebrae. So you know you can't be the 4-5 code. That gets rid of A and it gets rid of C, right? And we already got rid of D because we could not use the 31. So you know our only answer, what it could be, because we verified that we have to use our 30 code, which is only in A and B. And then out of the differences between A and B, the 45 and the 46, the only one that it could be is our 46 because we have 6 vertebrae. Where this one, if it was A, we could only have 2 to 3 vertebrae. But we did 6. So very unusual question for AAPC to have our answer be more CPT codes than any of the other answers. A lot of times they keep it small. But very cool question. Yes, you can bring your own phone number with you, absolutely. I've had this phone number since 9/11. I brought it from Memphis, Tennessee. Well, I guess I got a new number because my number is from Cali. And I moved to Cali in right before 9/11. That month I moved. The month of. So, yeah. I have a California phone number. Did everybody get B for their answer for this one? Everybody see why? All right, what about this one? You don't have to worry about the modifier. Are we in integumentary or are we in musculoskeletal? The two codes that are super close together numerically is A and C. I would run to those two codes and see what's going on with those. 230, what? 230, 75 and 76 are under shoulder and excision. This code again keeps popping up. And oh, good Lord, here comes Travis. I hear him screaming down the road. He must have some cheerleaders with him. Travis James Michael Brewer, I know you ain't scaring the neighborhood by screaming all the way down to the house. Travis. He must have ran to the bathroom. What's he doing screaming the whole way home?
Oh, because I was running down the hill.
Oh, he didn't want you to fall?
Oh my gosh, that's my favorite lotion ever.
Which one? Oh, that one. That one, you can take it home, actually.
Really?
I do not like it.
You don't?
I don't. I like this one better, and I don't like the smell of that one. Yeah. Take it home.
Your mom loves me.
Why are you stealing my mom's freaking?
I don't like the smell of that one.
Hey, Mom.
What are you doing screaming the whole way home?
That wasn't me.
Uh-huh.
That was Kendall.
You are not blaming that on your friend. Y'all be good. Oh, I got the mop ready for you, and be sure and take out the trash. There's no, oh, there it is. There's our size. I was looking for that. 4 centimeters. There we go. That helps out. So we know our answer for that one is A. Oop, let me get that off the screen. All right, what do you guys think about this one? We've got 2 of them that start off with the same answer. We've got the 81. What's going on with that code? 298. 298. 29881. Ooh, are we doing or? Those 2 codes are the hardest. The 80 and the 81 are the worst 2 sets of codes in the whole musculoskeletal section. And versus or. That means you did both medial and lateral repairs, not just going in the body, because your scope can go into a body laterally. That doesn't mean you did a repair laterally, so you got to be careful. But, or you did one or the other. If you're 81, you only did a repair medial or laterally, only on one side of it, but not both. 80 means you did both sides repair. But those 2 codes are the absolute worst in musculoskeletal to figure out during the middle of your exam, whether you did it or not, because you can't go by what scope. What I do is look for the name of the procedure, what you did, right? So we've got meniscus, what comes before it, right? That is helpful. Is always look for your surgery or look for the name of the repair or what you did, and then look right before it, because it'll tell you whether you're medial or lateral or whatever. Yep. But you guys won't have me during the exam. And you would think, because there's a lateral here and then there's a medial here, that you did and, right? But it's definitely an or. You only went in on that side, so we know we get rid of the 80. Now you just need to figure out, do you have the 77 or not? What do you guys think on TikTok? I know y'all ain't making my mama order y'all DoorDash Starbucks. No. No, y'all wouldn't do that to her, would you? They is some spoiled, rotten children. Rotten. DoorDash Starbucks. Don't forget me. I want Wingstop. We have a Taco Bell, a McDonald's, and a Burger King in our town, and a Starbucks, of course, and that's it. That is all we got. We got Pizza Hut and Domino's. But our darn town, we ain't got no Olive Garden. We ain't got nothing around here. It's too tiny. There's no Raising Cane's. No, we don't even have a Chick-fil-A. We ain't got none of that. It's so sad. We got a gas station that serves up chicken strips. It's only gas station chicken strips. That's all we got. Oh. Chinese. We do have a Dragon place. I'm trying to remember the name of it. Dragon? I don't know. Something Dragon. It's not like a franchise. So we do have one. I have to go to Vegas 2 hours away to get a Raising Cane's. The answer is not C. No. Remember, most of the time, if your answer starts out with the same answer, then it's a difference between those two answers. And most of the time, the answer will be the cheapest of the two procedures. So if it's a difference between two codes and one code, your answer is more likely to be D, always. 1% of the time, you might end up with that highfalutin thing that we had a minute ago, where this one had it being 5 codes instead of 4. That's a very rare question for AAPC, for sure. If I was just, doing this based off of process of elimination, looking for similarities, I'd pick A and move on with my day. But because we had the time, we could figure out the answer quickly by looking at the difference between 30 and 31, and then the difference between 45 and 46. And we found out B was our answer. for this one, unless you did something to a nerve, we're not billing anything else. We didn't do a nerve thing. What's our 7-7? That is two parents under the same mama code is such a rarity that you would bill that. And look at your descriptor for your 81. It has a chondroplasty inside of it already. It's in the parentheses. This one's just the chondroplasty by itself. This one includes the chondroplasty and the tear at the same time, right? We did both. This will do the shaving. The 81 does the shaving and the tear at the same time. So they just want to know, do you know that the 77's inside the 81? Before you build two children codes of one parent code, you better make sure you got two different legs or something. You know, if you're billing for the same surgery of two children codes under the same mama code, you better have a right and a left you're doing something on. Not the same knee is another thing to think about. All right, we got two of them that are the 72s and two of them that are the 71s. Let's go see if there's a different procedure or something noted. Let's see what's going on there. 71, 30, 71, 30, 71, 30, and 25 are under repair revision of what body part? Hip and pelvis. 72 what? 36. They're all under this, no? 72 is under fracture and dislocation. Okay. Are we dealing with the fracture or are we dealing with non-fracture stuff? C and D is for fractures. 71, 72, I believe are not. So we got somebody that was hit and we do have a displaced fracture. So I would keep the 72s because they're under the header of the blue header of fracture and dislocation, right? So we'll keep the 72s. So my difference is between my 36 and my 44. 36 and 44 on the next page. 36 and 44. One is open treatment. The other one does not say the word open. But they're doing the, they enter through the trochanter. Yeah. This one, they did internal fixation at the proximal end of the bone, where this one does the trochanter. They're both doing internal fixation. One of them's at the neck. All right. What do you guys think? Yep, we'll be at the fracture for sure. What's the difference between 27236 and your 44? It's like you're doing magic. Aw. I hope that's helpful. That's awesome. Indeed, I'm doing magic. Help you guys verify for sure the fastest, most efficient way possible that A and B are not the answer. These are the only two codes that are under the word fracture. Then your differences is this one is the neck part of the femoral area, and then the other one is trochanter. It's more of a fracture, not at the neck area of the bone. It's more of so like you've got your femoral leg comes up like this, and then it has that ball and joint right there. And that little part right there is what they're talking about as far as the trochanter area. That is your 44. The neck area right there, that's the skinnier part that attaches to that ball that's in your hip, that's the neck area, and that is the code for 36. So, get this to where you guys can see what the heck I'm drawing. So, you know, I don't know. That is your femoral leg, right? And then you've got that ball that goes into the hip joint right there. And then there's that skinny part that attaches to your femoral leg. There's that protrusion thing that comes out over the top of your femoral leg. That's the trochanter. Anyway, that is your 44 code. If the fracture happened out over there, but if it happened at the skinny part right before the ball that goes in your hip point, that's the neck area. And that's what 36 does. So yeah, C is our answer for that one. Yep. All right, we got time for one more, and then I gotta go get James. I'm gonna try to be quiet. You guys figure out how to do this one by yourselves. I'm scared to say it again. Oh. Look for similarities. guys. What you guys think is the answer? Everybody putting C down? I'm going to go D. So if we go and we look for similarities, A and D are super close numerically, right? And if we look at those codes, 2055, 2 and 1, they're under the header of introduction and removal under the red header of general. Are we doing a general injection? Just grabbing a syringe and injecting something. And what we're doing is we are injecting, but we're injecting a joint. And what do you call injecting a joint? That's not going to be under a code that just says injections of a tendon. What was the other one? A tendon sheath or a trigger point. That's not going to be where we're at, right? So we can exclude D and A. So we'll go to 20610, which is our next one. If we look under it, the header for it is arthrocentesis. That is a joint. We're getting closer, right? That does match our joint situation. And we do have shoulder. Let's go look at our 3350. 3350. If we look at it and we look at our headers, we're under other procedures, shoulder, introduction and removal, of course, but we also have our CT and MRI. And we do have the arthrogram listed, right? And if you do look at your description of the 50, we do have the arthrogram listed in there for the shoulder. So that's how you know that you are C with this one. We got some of our area with the 20610, but we just don't have the gram matching all of it. And yes, you guys are correct that it is C was our answer for that one. Anyway, very cool. A good set of practice exam questions for sure for musculoskeletal. I hope this was helpful for you guys for figuring out the answers. Sorry about my drawings. Oh my gosh. And especially this one was really cool. So we will do this again tomorrow. It'll probably start more about this time-ish than earlier like today did. So between 4 and 5 tomorrow, I got to pick up kids from a math competition or something, and then something for James's wrestling practice or something that he just started today, I think. So I hope that is super helpful, guys. And I hope you learned lots. Please practice your exam questions with red and blue headers now. And don't forget to, if you have the 2024 books, to go write in your 98000 codes for sure. That is super helpful. for you for the exam. That way you've at least got those in your book if you take the exam now, because I think they've updated it. Yes, I will see you guys tomorrow. Yes, 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 yes. I'll put up the link. I hope this was super helpful. Thank you so much for the gifts and the sharing of the videos, the likings, the taps. Thank you so much for the support of the stream, Beth, with your donation. That was super helpful. And I will see you guys again tomorrow, and we'll do another 2 hours. I love you guys. I hope this was helpful. And that's cool. Get back over here and in.